is serious injury is much more likely, as you might expect, if you fall from the height that's greater than your height. Fall off a ladder, fall off a stool, whatever. Anything that puts you up, the fall is going to be a greater distance and you're more likely to get hurt. So let's talk about a couple of these a little bit more. So this is a brain hematoma. This is something I really worry about many, many people. If you're on a blood thinner, you are at very much increased risk for this. You can get a hematoma inside the brain. There's a large sac that covers the brain called the dura. You can get bleeding in here, or you can get it externally. This bleeding can be slow. You may not know about it for many, many hours or days. So people that fall and hit their head have to be very careful, and those that are around you need to be very attuned to this. If you fall and hit your head and you're on a blood thinner, don't just get up and go back to bed and sleep. You may not wake up. So any symptom, slurred speech, loss of consciousness, seizures, numbness, severe headache, weakness, visual problems, anything of that type needs to be followed up. What I'm saying is you need to have a high suspicion for this problem and a low threshold to go off, be at the ER and get observed and followed. Another consequence, I mentioned my father, it's again why I've looked at this literature very, very closely. So hip fracture, among the top 10 causes of disability. Essentially every hip fracture is going to require surgery. Unfortunately, hip fractures set in motion a whole series of other events involving the heart, cardiovascular system, lungs, pneumonias, blood clots, infections, bleeding. Any of these can result in death. And the sobering statistic that at 1 month, 10% of hip fractures result in a death. And at 1 year, as many as 36% of patients that fracture their hip are dead. Of survivors at 1 year, 11% are bedridden, 16% need full-time assistance, and 80% must use a walking aid. So this is a major, major way to change your life. Go from an independent life to one of total dependence and potentially lose your life. So let me hammer this home. Who needs to go to an urgent emergent care after a fall? So certainly anybody with a laceration, with bleeding, severe pain over a joint or bone, hip, neck, etc. Loss of consciousness, transient or longer. I talked about those neurologic symptoms a moment ago. Those taking blood thinners or those falling and hitting their head. Can't emphasize how important this problem is. Any history of lightheadedness or dizziness before the fall, especially with a history of heart disease or heart rhythm issues. And everybody needs to be monitored for later period events. As not everything shows up at the moment. You can bleed slowly into your head, and that's the one. Again, do not just get up and go back to bed. All right, let's talk about fall prevention. What has been proven to work? So I talked about the medical evidence, and I'm going to show you studies, and we're going to talk about this A, B, I, and D grades I talked about before. So here are the lists. Things that work. So at the top, strength and balance exercise. And I've got in here in parentheses 2 things. These are grades given by 2 different groups. The first one is given by the U.S. Task Force in Prevention. This is a U.S. government agency that reviews data and makes recommendations on how strong the evidence. The second one are recommendations and reviews by the American Geriatric Society. And as I stated earlier, they don't always necessarily agree. People can look at the same data and come to different conclusions. But in terms of strength and balance exercise, both groups have given very, very high grades in terms of the effectiveness of these modalities in terms of reducing falls. In terms of a specific modality, Tai Chi has a very, very high ratings. The Chinese have it right. That does work. Multiple interventions, etc. Here we've got a disagreement. The American Geriatric Society thinks the data are strong. The U.S. Task Force for Prevention, I think it's still insufficient. Home modification, the same thing. Insufficient for the U.S. Task Force to make a strong recommendation. American Geriatric Society thinks it's strong. Psychoactive drug dose reduction or the reduction in drug number. American Geriatric Society wants you to reduce the number of drugs if you can. The U.S. Task Force, not so sure. People that have problems with postural low blood pressure, again, American Geriatric Society using what they call a cardiac pacing device, thinks that works. First cataract surgery. Again, insufficient data on the part of the U.S. Task Force, but the American Geriatric Society thinks it's good. Now, vitamin D supplementation, you probably all have been told to take your calcium and vitamin D over time. Well, if you looked at the data up to a year ago, it looked like vitamin D was a good thing. We've had more recent data to suggest that excessive amounts of vitamin D may slow down your reaction time and actually may promote falls. So here we've got a dichotomy. As again, I pointed out that data changes with time and you're constantly reevaluating, and I'm giving you what the state of the art is. Foot and shoe screening management. Nobody thinks the data is sufficient to really make strong recommendations, but if you know you're wearing flip-flops and you're stumbling all the time, you can make the decision on your own. Hearing screening, the same thing. Vision screening, again, the data are not sufficient to really make a strong recommendation. Now, why some of these groups hold off is that they have implications as to what insurance covers or what Medicare covers and the like, and they don't want to get ahead of the data. Interestingly, educational alone, what am I doing today? Educating you. Well, the U.S. Task Force says, go and give a lecture to somebody doesn't really change anything. So I'm working against that today. And the American Geriatric Society, their one study, I must say it was a poor study, they found that it probably was not helpful. So in any event, education alone you need more. It's how do you motivate people to really follow through.
How much vitamin C or D should you take?
Well, the recommendation is 800 international units a day, but most of us get adequate amounts, and the recommendations now, you probably don't even need to take it. So, but that's assuming that you're eating a normal balanced diet. And if you're living on who knows what, but you may not. But if you get enough milk, cheese, and that kind of thing, you're probably adequate. All right, basic home safety recommendations. I'll take these through various places. Entrances, railings and steps in good condition. Adequate day and night lighting. Kitchen, common items in reachable places. Rubber-backed, non-slip maps. Suction cup countertop bars if you need them. And of course, the higher your risk for fall, the more these apply to you. If you're not having a lot of problems with these, you don't have to, I'm not going to go get suction cup grab bars from my house. I don't need them, but if you need them, they're great. Stairs, cluttered, removed. Railings in good repair. And then these contrast strips should be on all steps so that you can see them. Hallways. Again, clutter removed. You don't want to be tripping over things. Added night lights. In the bathroom, I can't emphasize how frequently injuries and falls occur in bathrooms. Non-slip mats, grab bars for the toilet and bath and shower, raised toilet seat, adequate day and night lighting. Mr. Shank here just a few moments ago told me about a sensor that allows them to walk in the bathroom, the lights go on. I think that's actually great. But a lot of falls occur when it's dark. People don't see things, they're not aware. So those kinds of things are excellent. Okay, in terms of exercise, so exercise overwhelmingly has the largest impact in preventing falls, preventing injury, including serious injury and fractures. An exercise that targets the hip, flexors and extensors, like the squatting from the chair. Again, if you want to see where you are, just measure your ability to do what I was describing earlier about standing and sitting from a chair. If you had to focus on one area that you're going to try to strengthen, it's those